the stick doing the deep squat, and then the other one watch your partner do it. So basically what we want is one hand right at the base of the neck, and the other one down in the low back. And I failed this test, so do as I say, not as I do. But basically what we want you to do is feet shoulder width apart, keep that stick neutral on the low back, and you should be able to squat down as far as you can go. Hips should get below parallel. Knees should, again, track over the toes, but not go beyond them. And then I'll kind of be around too, just looking. So go ahead and give that a shot. A couple of things that I'm seeing just as I look around is some people are starting to point their toes out a little bit to get down. Again, that can be a compensation for a little loss of dorsiflexion in that ankle. I know a lot of times with some of the squatting activities, you want the toes pointed out a little bit, especially when you get weight, just because that helps you get down a little bit deeper. For a functional screen like this, where it's not a weighted activity, we do want the toes pointed straight ahead, because one of the things that we're assessing is that ankle joint mobility, the ability to get through that dorsiflexion. So if you haven't already switched, you can go ahead and switch partners, and then the other person can kind of evaluate. Tight pants. Excuses. So is anyone finding this activity more difficult than if they were squatting with weight?
What about that? I mean, are those 3 points, like I feel my mid back coming away from that, like right about there, is that?
So that goes back to some of that extension compression strategy. So ideally we want you to keep a neutral lumbar spine as you're going down through there and not extend it further.
But don't you want that natural little curve right there? Go again, Joy. So it's a natural curve.
Yep, so we're just making sure that it doesn't increase at all. So right in the middle, he starts to increase it, and then he comes back out.
So then when he's flat at the back, at the bottom, that's what you want to see?
Yeah. So yeah, I mean, there is definitely that, natural curve to the lumbar spine. We just don't want to see it increase at all as you go down.
Okay.
Perfect. All right. Anyone have any other questions on that at all? That was a great question.
What would you say, so with her feet come in?
Yes.
And is that not, sorry. Is that more a hip thing or just ankle flexion?
That would be something that we'd have to take a little bit better look at. So then we go into like the 6-inch step down to check how her ankle mobility is. A lot of times with the knee going in, or when you have knee pain, it's not a knee issue. Anytime anyone comes in with like anterior knee pain or medial knee pain, we're definitely going to do the orthopedic test on the knee just to make sure all the ligaments are intact. But the knee is kind of like the middle child. It gets blamed for what the hip and the ankle do. And the knee can only do what the hip and ankle allow it to. So a lot of times when that knee comes in, the knee is not meant to translate in, and it can usually be one of two causes. Either you lack some dorsiflexion in the ankle, so you roll your foot in to try to get around it, or that overpronation, or it's a lack of glute med strength, because that glute med is what externally rotates the femur or that thigh bone and keeps it out. So that's where we have to do another test then to see. You can't always tell right away. One other thing you can do is put a little step under the person's heels, and that takes dorsiflexion out of it because it gives them like a fake amount of that ankle motion, and then you can see if that knee is still going in there, or if they're still leaning way forward there. So, do you mind if I pick on you for a second?
No, that's fine.
Okay. I'm just going to grab the step here. And Chris, I apologize that this says Gold's Gym on it. I didn't see any of these that said Workout Boss on it.
I have duct tape. We can cover it up.
So first of all, let's just have you go ahead and do a squat without that. So you can just put both hands over your head and go ahead and do the squat. So you can see how she has a lot of back extension when she does that, and then she leans forward a lot from the hips. And then that extra extension comes when she tries to get that chest up. So let's have you step on there with just your heels. Perfect. And then go ahead and do it again. That looks a ton better, right? Now when she does that, her knees translate over her toes a little bit, but we're also bringing her by bringing those heels up, that's kind of expected. So that is one way to screen, you know, whether it's an ankle mobility issue or something else. So you can see, I mean, that's kind of a big step. Normally we'd only go like 2 inches on it, but you can still see just what a huge difference that made just right there. So thank you for allowing me.
You're welcome.
All right, so let's go, yeah.
Alright, so I've had people do that on like 10-pound plates. So as far as programming goes, when you're progressing and you want to get your heels to the ground, you just reassess and see if you're back there.
Exactly. So yeah, I would, in that situation, I would recommend doing it with the 10-pound plates under the heels, like even during workouts, just because that's going to save the back, the knees, you know, all that. So, and then gradually decrease it, and in between workouts, have them be working on stretching, you know, either it's a tight calf that isn't allowing you to get that ankle dorsiflexion, or it's a joint restriction in the ankle and it needs to be mobilized. So then, you know, finding out which one it is, and either stretching out the calves
So
or...
once it gets strong enough, then you can take the plates off and you'll be able to.
Right, yep, yeah. And a lot of times in that situation, it's not as much a lack of strength as like a lack of mobility. So just having like overly tight calves that, I mean, you can't stretch the calf past this point. So just working on being able to stretch that calf out to get through there. So then the next one we'll show is a 6-inch step down, and I only brought one step along, so I'll just kind of demonstrate what it looks like. Normally we have 2 blocks that we put under here, so it's up 6 inches. Basically all you do is have the patient stand here and just go down and tap their heel. So again, in this situation, the knee is going to translate over the foot a little bit, but it's more of a functional screen and we're not checking for that. So the big things that we're looking for here is, again, just that knee going in. So let's say you had someone with 4 squats, sorry Rachel, you put their heels up and that didn't change at all. If you come to the 6-inch step down, have them do this and that knee goes way in, then you know you're dealing with more of a glute med issue. If you bring them over here and do that and they can't keep their heel down, their heel comes up, then a lot of times you're looking again at the ankle mobility or the tight calves. Alright, so the next one that we'll do, oh perfect. Thank you. Alright, Rachel, do you mind if I click on you?
Don't worry, it's just gonna be blasted all over YouTube.
Yeah, this is YouTube sensation, it's going viral. So let's just have you stand on the right foot and go ahead and try to just tap that left heel on the ground for me. Alright, so you can see that her heel comes up when she does that. Step off that step for 1 second. Alright, try to do like this. Okay, yeah, you can see that heel still comes up a little bit. Not looking from the front, I can't see if the knee's going in at all, but go ahead and do it one more time. So the knee does come in a little bit. Rachel does a lot of running, so a lot of times in runners, we'll see a weak glute med just because they're always going straight forward. They're not getting into some of those other planes of motion. So they'll have a very strong glute max, but the glute med weakness is there, and that causes some of that knee pain. So thank you very much. Step down. Excellent. All right, let's go into some more of the shoulder screens now. So if you can find a little section of wall with your partner, what we'll have you do is, for the first one, heels about 3 inches away from the wall, and then rock the hips back. You just lean up against the wall, bring those arms up. I'll have you slide down, keeping the arms where they're at. And the things that you're looking for here is just to see, again, if that lumbar spine is coming off the wall. Sometimes as someone starts to go down, their hands will come forward. That can be either tight pecs or tight lats. But those are, so grab a piece of wall and go through that screen with your partner.
Yeah.
Let me know if you have any questions at all.
I remember this one.
Yeah.
I know sometimes we can compensate by flexing it out and getting that chest, and that's something we've been dealing with people in their overhead squats. When we get that flexion right here, we get those hips instability, but when we I've been told you almost want to tighten it up as if someone's about to punch you, and all of a sudden you see it like this, and it just rotates all that over. But then what we find is that that barbell path is now not over your body, it's over your toes. So then getting here, so would you recommend if we're working on this to really suck in that rib cage to the wall?
Exactly, yeah.
And then get down?
Yep.
How far from the wall?
Just till your arms get, like 3 inches.
Like that?
Yep, perfect.
Split the wads.
Yeah,
That's
just
sliding.
Yeah, so, that was a really good point. But when you see that lumbar spine come away from the wall, a lot of times that can be like a lack of mobility in the thoracic spine or in the shoulders, and you're just compensating for that. So it's definitely, so on this one, your knees are going to track over your toes, but you were not looking for that lower extremity function on this one. We're just looking for the shoulder and your back mobility. So, any questions on that at all? Anyone's lumbar spine come way off the wall as they're sliding down, you can throw a whole arm back there.
So would you say, with all these movements, if, say with Julie, with when she's training to actively, now when she's practicing, she's going through the repetitions to really hit each repetition as if she wants to do it properly, it's kind of common sense to say yes, but now when she's on her own, would you recommend her to really get into it on her own instead of just trying to correct it during a workout?
Yeah, absolutely. Yeah, that's huge.
Okay.
All right, so now,
kind of going on with Joey's. I kind of do the same thing Julie does, where when I start squatting with heavier weight, it comes forward, start taking weight off until I can get the form right.
Yeah, that's my recommendation. Is that form is way more important than the amount of weight you're doing.
Okay.
One, you don't want to end up hurt. So let's say you're able to do more weight now, fantastic. But if you're hurt in 2 weeks, then have to take time off, and then you're starting over at a lower weight. It's better to gradually build up and make sure that form and that technique's there.
But now, what if the heavier? I feel like I have better form when I have a heavier weight. I think the weight obviously compensates for. If I have a heavier weight kind of almost pulling me back, I think that compensates me for going forward more, so.
Yeah. A lot of times with that, there is a compensation there.
Yeah.
So, I guess I'd have to see it to know for sure.
Sure.
But a lot of times just adding the more, axial compression can help, just because it's forcing your heels down.
Yeah.
I think you're compensating with your shoulder mobility then. If you're talking about an overhead squat, when you're coming down like that, you're forcing your shoulders to go way far back.
Yeah.
Versus getting rid of the real problem, which is.
And that may go back to what Joey said too. If you're coming forward with no weight, and then once you get weight on, you're going like this. It can be more back extension that's destabilizing the lumbar spine and really firing the erectors back there. Or it can be just you're coming too far back with the shoulders to try to keep the bar over where your center of gravity would be, but not necessarily over where your ear should be. So, do you agree with that?
Yeah, that's kind of what I noticed. Even for myself too. Just kind of having to push those shoulders way far back instead of getting that proper depth with the back straighter.
Sure. Proper technique with still using a little bit of resistance. So basically what this is going to do is you have to fire that posterior chain to keep yourself from leaning way forward with this. And just being able to sit down in that perfect position. Just repeating that over and over until it kind of becomes an ingrained pattern. And then eventually, you using less and less resistance to it until you can just get down there without any. But now going into some stretching stuff. So we'll start out with the hip flexor, just because a lot of people have those tight hips. So basically just wrapping the band around the rigging. And then what you're going to do is bring up to just under your glute. And then go ahead and sit back. And as you lean into it, you're really gonna feel that it just, much deeper stretch through that hip flexor and the psoas than you could get just doing this activity on your own without that pull.
You go, man.
If anyone wants to do like a modified Thomas screen just to see kind of that hip flexor quad tightness, we kind of go through that. Alright, so we'll have Chris sit on the very edge of the bench right here. So you want to make sure that the person is far enough forward that when they lean back, you're going to slide back a little bit, so you want to make sure you have room for that knee to clear the edge of the table. So let's say you pull your left foot up to your chest first, and then go ahead and lay back. So basically what we're looking for here is just that the thigh is parallel to the ground and then the knee is at 90 degrees. So a little bit of quad tension here. Go ahead and switch to the other side.
And like the intent is not to try and force stir, so you can see that that one.
Right. The intent is to just have them relax.